Suzanna, the first question I have is very simple, but I'd just like to know the answer. What is it, clinical hypnosis?
What is clinical hypnosis? A clinical hypnosis is that the state of trance is used as a helpful state in order to reach the goals for a contracted therapy. You have a treatment, you have a goal to get rid of some symptom or some problem, or deal with or manage symptoms or problems, and it's a state that is helpful for reaching the goal. And clinical hypnosis also includes the relational parts or aspects of a therapeutic relation.
It used to be that people that were doing hypnosis, they were saying that it depends how deep you are in a trance. You get a different level of work you can do. Does it matter how deep a person goes in a trance, so you can...
With some conditions it matters. For example, if you work with someone in surgery or anesthesia where there is a very painful procedure going on, for some the depth is quite important in order to distract from the pain. They need depth in order to deal with the pain. But when you do ordinary therapy, some people just need to close their eyes and let forward their imagery, and it's not important if it's any depth, because if you believe that depth is important, then you start to try to achieve depth. And to try something is really contraindicated when you work with hypnosis. Don't try, just let it be as it is.
Is it hypnosis itself can be helpful for the body, or you have to use some techniques with the hypnosis?
If you talk about the state of trance, hypnosis as a state, there is a state of default mode. Neurologically, we call that default mode nowadays. And that means a kind of restful state of mind in which the mind is sorting and doing things automatically with the input that you have received. And you need that. And many people nowadays who are suffering from stress-related problems, they have too little of that default mode. So self-hypnosis is a way to teach them to reach a natural resting state that is beneficial and healthy by itself. And that may be the goal of therapy for some.
And you've been doing hypnosis for a long time, and I just want to know, what do you think changed in the last 30 years in Sweden and all over the world in hypnosis?
There was, 40 years ago, there was this debate between how to explain hypnosis. If hypnosis is a state of consciousness, an altered state of consciousness, or if it's just a role play, patient acting as expected, but having all the awake resources. And the difference now is that there is neurological proof that there is a difference in the awake state and the hypnotic state. Why do we need that, and what is the complication, or what is the consequence? For me as a clinician, I don't mind the neurological explanations as a clinician because I rely on what I see. Right. But for academic purposes, now there is that debate doesn't exist anymore.
And during your class, you told us a story that you had some medical professor that he had to leave your class.
Yeah.
And I just wanted to know why. And in case, like when we organize the classes, we are checking if these people have a doctor degree or a diploma of psychotherapist.
Yeah.
But what kind of qualities someone has to have
Yeah.
to be a good hypnotherapist?
Well, that are two different questions, because legally and to make us as an organization, as a society, on the safe side, so to speak, we need that if you will do clinical work with hypnosis, you need to be registered by the state, so that if a patient has complaints for a wrong treatment or causing damage, then they cannot report to us, because we don't want to deal with that. It would be very difficult. So there must be some neutral or some state authority that deals with complaints.
Right.
And that belongs to licensors. So if you are licensed in health and care profession, there is such an authority. So we have patient security as the principle. You are either licensed in health and care, or you work in team where there is a superior person who is licensed and responsible for the treatments.
Right.
And this professor, he had only a very high university degree, but he was not registered as a clinical licensed doctor.
The reason why he had to leave.
I would have admitted him, because he started the course with a pretense that he was only attending the course for scientific purposes. He wanted to do research on hypnosis. And I said, yes, that's okay, because if you are going to do research on hypnosis, you can join the class to learn about hypnosis. But that does not mean that you can treat patients with hypnosis, because you are not licensed as a clinician. But he cheated on that. And he was very unprofessional in his way of doing hypnosis.
Okay, thank you. And the last question I have, maybe you can have some advice for us, because I'm sure you have the same problem as we have in Russia and Sweden, that there is people that learn clinical hypnosis, and there is people that do hypnosis on the streets and, you know, the show. And for just regular people, hypnosis is very often in association with some kind of miracles and you know, that they lose their control and somebody can manipulate them. And in our association, we are thinking, you know, to do some kind of information for the people, to let them know about the different side of the hypnosis, so they don't think, you know, it's dangerous way. What do you do in Sweden to informing people about hypnosis and how helpful it can be?
Since about 10 years, the last 10 years, our website is visited a lot. So the common people who want hypnosis for treatment, they search on Google or any of those search motors, and they find the Swedish Society of Clinical Hypnosis quite quickly. And then they click on that, and they find what is clinical hypnosis and who is licensed to do that, and how can you know that someone works seriously. And we inform about that. And I also advise people on that site to don't be impressed by all the certificates and diplomas that are on their walls, because anyone can have a diploma in a weekend. But ask, apart from this diploma, what is your basic profession? And if there is no basic profession in a health and care profession, then be careful. Find someone in our society, and we have a list of members who are licensed or who have our certificate, so they can search through that list of members. And then, of course, anytime you speak to colleagues, anytime you speak to journalists, or so, mention clinical hypnosis and spread papers and just keep it in mind everywhere.
Okay, thank you. Thank you,
Yeah.
Susan.